One of the most interesting things about ketamine is that it actually works on a completely different neuroreceptor as well as a completely different neurotransmitter than traditional mental health medications. So that means that perhaps you're on these traditional meds and they're not giving you the relief that you're looking for. This is a completely different way for you to attack those symptoms and to give you a little bit more of your life back. Also, ketamine is known as a class of drugs as a rapid-acting antidepressant. So instead of the normal 6 to 12 weeks that a normal antidepressant such as an SSRI or an NSRI, as opposed to them taking 6 to 12 weeks, ketamine can give you excellent effects and help with your symptoms in as little as 1 infusion. Yeah.
That's fast.
Very fast. And it can be an excellent bridge for a lot of people that are transitioning to those meds, that are looking to get off of those medications, whatever it is, or just as an excellent adjunct to the medicines that you're using successfully, but perhaps you don't want to use your rescue medications as frequently. Again, this is a great alternative, and I believe really something that people should explore.
So what to expect and how does it feel?
So when you come into revived hydration for ketamine therapy for your first infusion, you're going to meet with one of our physicians who's going to go over at length your medical history, your prescription history, your allergies, as well as go over the risks and benefits of ketamine therapy. After that, you're going to be placed in one of our private rooms where you will be provided with something to drink, a nice warm blanket, trying to make it as comfortable as possible for you. And you will meet with one of our registered nurses. That registered nurse will start an IV for you and then start the infusion after he's applied all of the monitoring equipment. Now, once the infusion starts, people have a lot of questions about how does it feel? How is this going to make me feel? The first thing I want to stress is that you're going to remember everything. You're going to know everything that happens during this experience. But what you're going to notice is that you are going to have a little bit of a hard time finding words. Perhaps you want to speak and those words are kind of escaping you. You're going to notice that colors seem a little bit brighter, that sounds may be a little bit louder for you. You also may notice that you have a pretty bad dry mouth. These are common things that people tell me while they're receiving this infusion. But the biggest thing during this infusion is that you have this overall sense of peace and relaxation.
First, go ahead and tell me about the ketamine experience and what it is all about.
The ketamine experience here at Revived Hydration, it is a very personalized experience. So when you first come in, you're going to meet with one of our physicians. He's going to go over your medical history, he's going to go over your medications and allergies, and go over with you in detail the risks and benefits related to ketamine therapy. Then after that, you're going to meet with one of our RNs, and that RN is actually going to be with you during that entire process. So from the moment we put the needle in to the moment that you walk out the door, you're going to be seeing that RN every 15 minutes, even a little bit more, as we're there to guide you and make this a really personalized experience.
Now, what kind of monitoring is occurring? Do you have people, hooked up to?
Oh, absolutely. So during the infusion itself, we have you hooked up to monitors so we can monitor your heart rate, we can monitor your oxygen levels, as well as your blood pressure to make sure that you're at the safest level at all times.
Gotcha. What, if any, research is behind ketamine and helping mental health, or helping rather with depression, anxiety, and PTSD?
Excellent question. So about 10 years ago, researchers in the neuropharmacology field started to take a look at new medications that could help people that have intense issues with major depressive disorder, PTSD, and chronic anxiety. And what they found was this medicine, ketamine, that was established in the 60s to use as a battlefield anesthetic, but now is being used in longer infusions over lower doses over a longer amount of time during an infusion. And they're finding that it's working differently. It's working on different receptors in the brain, producing more of what they call a rapid-acting antidepressant. So some people can actually get relief of certain symptoms in as little as one infusion. Yeah, it's really revolutionary, and it's one of the newest, most exciting things to come across in mental health treatment in the past 10 years. So at Revived Hydration, we decided to get into ketamine therapy because we saw that there was a little bit of a vacuum. There was other clinics in the area that were offering ketamine. We've seen other clinics around that are doing it, and they're kind of giving a not so personalized experience. And we felt with this revolutionary treatment that it really needs to be about the environment, about the experience. You need to be feeling that you are at your safest, and you need to be able to be as vulnerable as possible. And so we really wanted to step in and provide that in the most comfortable, most safe environment.
Now, you mentioned that you're going to be allowing people to bring in their own therapists. Can you expand on that?
Absolutely. So using this medication, people really find that their ego falls away, that they really are not looking at things emotionally. They're able to look at past traumas objectively. And with having that as a tool, we are encouraging our clients to bring in their own therapist who knows exactly where those traumas are lying, so that way we can get to the root of the issue. Our goal here is that you'll never need us again.
Now, what if somebody doesn't have their own therapist?
If someone doesn't have their own therapist, we do have a therapist on staff that can sit with them and help them guide through this process. We will encourage you to continue with your own mental health treatment, your own mental health provider, as well as your own physician, and stay on your own medicines. But this person will be able to help guide you through that process, so that way you're getting to the meat of the situation that's bringing you to us.
So when it comes to like the protocol and the campaign of ketamine treatments, what does that look like for each person?
So for each person, again, it's highly individualized. However, what we recommend, and this is because of the numerous studies that we have been reviewing to create this protocol, is that you would receive 6 infusions over a course of 2 weeks. Those infusions can last anywhere from 45 minutes to 2 hours, depending on what your chief complaint is. And then after those 6 weeks, that period that we call the induction period, after that period, people will come in about every 6 to 8 weeks, depending on their needs, to help them with any type of breakthrough symptoms. If they find that they don't need us in those 6 to 8 weeks, that's great. Sayonara. But if you find that you do, we're here for you. And people, through research, we found that clients can actually terminate and not do as much ketamine therapy in the subsequent years.